welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Dissatisfied with post-OP pain, US patient enters hospital and kills treating surgeon and 3 others. Showing that violence against doctors is a worldwide phenomenon, a chilling report has come from the US where a patient gunned down his treating physician on account of post-operative pain. Blaming a doctor for ongoing pain after back surgery, an angry patient opened fire at a Tulsa medical office, shooting 4 people, including the doctor who has performed the surgery. Due to an increase in the trend of aggression and violence against doctors, it has become a frightening new epidemic worldwide. The man who opened fire had purchased an AR-style rifle hours before fatally shooting 4 people. Before shooting himself, the authorities said on Thursday. Tulsa Police Chief Wendell Franklin says that gunman had recently undergone back surgery and had called a clinic repeatedly complaining of the pain. Franklin also says that the doctor who performed the surgery, Dr. Preston Phillips, was among those who was killed on Wednesday. Doctors can refuse to treat patient if pre-indicated fees not paid, according to NMC draft guidelines. Except in emergency situations, the doctor can refuse to continue to treat a patient if the pre-indicated fees as informed by the doctor to the patient is not paid. A clause to this effect has been included in the recent draft National Medical Commission Registered Medical Practitioner Professional Conduct Regulations 2022. The draft guidelines lay down the model code of conduct that is expected out of each doctor practicing in India and registered with the NMC. While the guidelines spell out the series of responsibilities of doctors, including those towards the patient, towards society, as well as towards each other, there is only one point on the right of an RMP, and that relates to the right to remuneration. Another Delhi-based doctor arrested in kidney racket. While probing the kidney racket case busted on Monday, Delhi police arrested another doctor on Friday from northwest Delhi. He was working at a private hospital in Uttamnagar. Police identified the suspect as Dr. Priyansh, who was 34 years old, alias Sameer, a resident of Rohini. He completed his medical studies in Uttar Pradesh, earning his MBBS degree from a college in Bareilly and the MS degree from a college in Etawah. Benita Mary Jacker, DCP of South, said that the arrested man was a surgeon. During investigation, the cops found that the Sameer was assisting the man accused, Kuldeep Ray, in the transplantation in racket, and he was paid rupees 1 lakh per transplant. ICMR, a National Institute of Allergy and Infectious Diseases, invites applications for clinical research fellowship program. The Indian Council of Medical Research Department and the National Institute of Allergy and Infectious Diseases and National Institute of Health, in collaboration with the Bill and Melinda Gates Foundation, have teamed up to provide opportunity through clinical research fellowship. MD/MS medicos can apply for the fellowship by 1st of July. Earlier, the last date of the application was 1st June. This fellowship will enable clinicians from India and the United States of America to conduct research, hands-on experience in Indian and US lab that will advance discovery to improve clinical practice and benefit public health in both countries. Medical degree certificate, not marketable commodity, cannot be withheld for unfulfilled bond terms, said High Court. Providing relief to around 25 PG doctors whose original certificates had been retained by the medical colleges on the ground that they had not completed their bond terms, the Madras High Court bench has recently clarified that unfulfilled bond conditions cannot be the sole ground for withholding original education certificates of students. Therefore, issuing a direction to the medical colleges and the State Directorate of Medical Education to return back the documents, the bench, comprising of Justice G.R. Swaminathan, noted that it is well settled that an educational certificate is not a marketable commodity. Therefore, there cannot be exercise of any line in terms of Section 171 of the Indian Contract Act 1872. It has been held in cantina of cases that management cannot retain the certificates of the students. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.